Presenting our special need dentistry innovation, the U-Dent Brush. Supervised by Dr. Ilham Wan Mokhtar and our group leader Farhaa, Nasrin, Nasarudin, accompanied by Group G members. Before we begin, let's talk a little bit about cerebral palsy. It is a disorder of movement and posture caused by a non-progressive abnormality of the immature brain that originates during the prenatal or perinatal period of the first few years of life. This results in significant impairment of functional mobility. There are 4 major subtypes, which are spastic, dyskinetic, ataxic, and mixed cerebral palsy. The clinical manifestation of cerebral palsy includes intellectual disability, seizure disorder, delayed motor development, limb spasticity, persistent primitive reflexes, and involuntary movement and ataxia. The oral manifestation of cerebral palsy includes enamel hypoplasia, dental erosion, delayed eruption of permanent teeth, dilated hyperplasia, increased incidence of Class II Division I malocclusion, and increased risk for oral trauma and injury. Here are some facts about children with cerebral palsy and their oral care that you might not know about. While 40% of the participants' children without the disorder had regular dental visits, only 23.6% of the children with cerebral palsy had seen a dentist. We are targeting a niche population mainly focusing on cerebral palsy, but other target market can also benefit from our product, such as dentists or pharmacy, patients with cerebral palsy and their caregiver, those with poor manual dexterity, child with behavioral management issues, children below 6 years old, and patients with disabilities who require constant assistance. The objectives of our innovation is to help with oral hygiene routine and care at home, reduce caries and periodontal risk of patients, reduce fear and anxiety among cerebral palsy patients during oral care at home, as well as promote positive attitude towards dental hygiene. Parents or caregiver of cerebral palsy patients often find themselves discouraged to maintain their child's oral hygiene practices, especially when their child is unable to spit, swallow, and tend to gag due to saliva and water pooling in their mouth. But fret not, our solution is the U-Dent Brush. It is equipped with U-shaped tray brush connected to an electronic vibrating motorized tool and a suction pump. It is also an electronic vibrating motorized tool that moves vertical, horizontal, lateral motion instilled within the tray brush to ensure all surfaces, which is the front, back, and occlusal part of the teeth, are free of biofilm by just pressing the switch. A suction pump in the size of an adult hand grip is also available to ensure no water or saliva pulling that occurs in the mouth during the brushing process. In the current market, the readily available similar type of brush have a much bigger suction gun, yet it is portable and expensive. It is not fully trusted in terms of size, and they also have an expensive electronic tray brush. However, for our product, the U-Dent Brush, it is a 2-in-1 product which are very affordable and time efficient. It is light, user-friendly, and hygienic. Some of the improvements of our product in the future include variety sizes of tray brush, a custom-sized tray brush, a smaller and concise device, a wireless rechargeable mouthpiece dock, an automatic suction gun, and an app control device. So this is a live view of our U-Dent Brush. It has a vibrator, a U-shaped brush, saliva reservoir, suction gun, and a power switch. Suction tips are also attached to the inner side of the U-shaped brush. Turn on the power switch and the vibrator will vibrate the brush in all directions. The suction gun will suck all the water and saliva into the reservoir and then discard.